Last year we did a thing called the Crucible, where we got trainees to speak about different things that they thought we caused harm in haematology by doing. And one of the biggest things that came up there was the way we treat pain, or in fact our lack of imagination in how we treat pain, particularly chronic pain in haematology patients. Taking that forward, people asked that we delve into the grey areas in haematology a bit more, and this is a way of doing that. What we're doing is getting various members of a panel, so made up of 2 patients, a psychologist, an artist and a retired haematologist, to talk about some of the complexities in pain and how we deal with it. One thing that we've probably done in haematology is to oversimplify pain. So we often ask people, how's your pain out of 10? Is the medication working, is it not? And actually for people who endure pain every single day over decades, these questions probably aren't good enough, and in fact they probably do more harm than good often. They're just simply not fit for purpose. I think what we wanted to do in the session is to re-problematize pain, to sort of allow it to be as complex as it is a little more by hearing the stories of the patients. And I think the artist who's going to be speaking, she's done a lot of work on using photography, of using art to communicate pain in different ways, and how that might impact on some of our clinical practice, either by using those techniques or by using other ways of, I think, empathizing at a deeper level with what our patients go through. I think our retired haematologist who's going to be speaking is going to bring out some of the complexities of how we use pain relief, and we're also going to have an opportunity for the audience to ask some of their difficulties and their uncertainties about this. I'm part of the Global Haematology Special Interest Group, and there's 2 schemes that we're wanting to mention and that if anyone's interested in, we'd really love to hear from them. The first is called the Plenary Speakers Scheme, and what this is it allows BSH members to support international haematology meetings happening in low-resource countries, such as in Africa or in South Asia. And these meetings are often looking for people with expertise in particular areas of haematology, and we're really keen to be able to support people to go to these meetings, to be able to speak at these meetings, and also to support other local educational initiatives. The second scheme is called the HVO, which stands for Health Volunteers Overseas scheme. HVO is an experienced organisation that's been running for many decades in supporting healthcare in low-resource settings. And we're starting a scheme this year, a pilot scheme with the BSH, to send people who are experienced haematologists, haematology nurses, haematology laboratory workers to again support schemes that might look at starting new protocols, that might look at validating laboratory tests, that might look at improving local clinical governance in haematology centres around the world, particularly in Southeast Asia is some of where our main partnerships are going to be. And so again, if anyone has an interest in that, we'd love to hear from them.